Sanitation workers' safety and welfare must be urgently addressed. Aditya Bol writes, as frontline workers during the pandemic, they faced great risks. The second phase of Swachh Bharat mission must focus on their concerns. Sanitation work in the country is inextricably tied with caste-based occupational roles. File. COVID-19 pandemic has tested our patience and resilience. The frontline workers have labored with unrelenting grit in the face of obvious health hazards. Many of them, especially the sanitation workers, had to face greater risks, in addition to challenges they routinely face. The pandemic should lead to urgency in addressing issues related to their safety and welfare. Sanitation work in the country is inextricably tied with caste-based occupational roles. The bulk of such work is done by people from scheduled caste communities and scheduled tribes in some areas. Sanitation workers have, for long, been subjected to discrimination, stigma, and even untouchability for years. The most stigmatized among them are those engaged in the manual cleaning of sewers, septic tanks, pits and drains. Despite the prohibition of employment of Manual Scavengers Act, 2013, the practice continues unabated. Although local government bodies do not directly engage manual scavengers, the practice continues because sanitation work is subcontracted to private businesses and informal laborers. The 6th Economic Census, 2013 reported that from the roughly 1.7 lakh recorded businesses under the broad activity of water supply, sewerage, waste management and remediation activities, 82% of the businesses are in the private sector. The demand for sanitation work, which had already been growing due to urbanization, has witnessed a steep increase following the successful construction of toilets in the first phase of the Swachh Bharat mission. The flagship program has led to the construction of toilets with on-site sanitation systems such as septic tanks and pits in both urban, peri-urban, and rural areas. There has been an emphasis on larger sanitation infrastructure such as sewage networks, sewage treatment plants, and fecal sludge treatment plants through the Atal Mission for Rejuvenation and Urban Transformation. However, with the focus largely on 500 cities out of the 4,041 statutory towns in India, and because of inadequate sewage network and treatment plants, the safe treatment and disposal of waste lags behind toilet construction, much of the demand for desludging and other sanitation services is met through private vacuum truck operators, who are known to flout the ban on manual scavenging and violate safety standards. The Manual Scavenging Survey, conducted by the Ministry of Social Justice and Empowerment, counted 66,692 scavengers till October 2020. However, given the extent of informality in the sector, it is challenging to arrive at an accurate estimate of the number of manual scavengers and sanitation workers. The latest National Sample Survey data, 2019, shows that more than 65% households in the country have toilets with septic tanks and pits. The corresponding estimated figures for villages and cities with less than 1 million population were nearly 73% and 68% respectively. These figures underscore the need to augment the sanitation value chain, particularly in terms of mechanized cleaning and treatment of waste. The extension of the Swachh Bharat mission, Gramin and Urban, and Atal Mission for Rejuvenation and Urban Transformation to their second phases, entailing the prioritization of safe treatment and disposal of waste, along with building sanitary toilets, is, therefore, salient. Such efforts should be complemented with welfare measures for sanitation workers. The Ministry of Social Justice and Empowerment has been taking measures for the rehabilitation of sanitation workers under its revised self-employment scheme for rehabilitation of manual scavengers. The scheme provides one-time cash assistance, loans at concessional rates, subsidy and skill development training. The National Safai Karmcharis Finance and Development Corporation is building capacities at the local government level, equipping these government agencies with mechanized desludging trucks and providing financial assistance to sanitation workers, manual scavengers and their dependents. The proposed national action for mechanized sanitation ecosystem plans to set up units at the district and local government levels to monitor sanitation services, including the activities of private sanitation service organizations. Mechanization of sanitation will be synchronized with decentralized monitoring of violations of sanitation protocols and informal education campaigns. These schemes could pave the way for eradicating manual scavenging and ensuring welfare of all sanitation workers.